Hello and welcome to a discussion on the blood histology. We're going to focus mainly on the cellular component of blood, but also remember that blood is also made up of plasma, and within the plasma you find the proteins, you find the electrolytes. The proteins are going to be proteins like albumin, fibrinogen. Then you have the globulin portion, which has alpha globulins, beta globulins, and the gamma globulins, right? Then this is a blood smear, right? And unlike the normal staining that we do in general histology, for this one we don't embed the tissue in paraffin or section it. You're just going to place a drop of blood and you put a slide on top, right? And if you look at the bottom picture here, these are blood cells. These are all red blood cells. Right. So these are red blood cell. That's a red blood cell. That's a red blood cell with the central pallor. Those over there, those are going to be platelets. So the dots there, they are fragments known as platelets, which fragment from thrombocytes. Then these are leukocytes. That's a leukocyte. That's a leukocyte. To be more specific, that's an eosinophil. Then this right here, that's a neutrophil. And if you look at the bottom slides here, that's another neutrophil. Those are still red blood cells, red blood cells, red blood cells. These are thrombocytes, fragments, which are platelets. So those are your platelets, the small dots over there. Right. Then this is a slide showing sickle cell anemia. We can see the sickling cells in the board-shaped cells, these ones. Right. That's sickle cell anemia. Right. And these are that's another red blood cell. You can see the central pallor there. Right. And red blood cells, if you remember from your general histology, red blood cells are considered a histologic ruler because they can be used to approximate the cell sizes of other cells in blood. Right. And they have a diameter of about 7.8 micrometers, a lifespan of 120 days, after which they're removed in the open circulation of the spleen. They're also removed by Kupffer cells. Right. Then if you then look at the next slide, this slide just shows us these are red blood cells again. So all these, they are red blood cells. Then the dots there, those are your platelets. Then that's a neutrophil. That's an eosinophil. Right. And problems within these red blood cells can then lead to things like anemia. You can have hemoglobinopathies if it's a problem with the hemoglobin, which is the oxygen carrying component, which also binds carbon dioxide and carbon monoxide. Remember, you talk of carboxyhemoglobin when you bind carbon monoxide there. Right? Then you can have things like spherocytosis, which can either be hereditary or can be caused by things like autoimmune hemolytic anemias or even infections with Clostridium perfringens. Right. You can also have things like hereditary elliptocytosis or even hereditary stomatocytosis affecting your red blood cells. Right. Then if you look at this, the bottom pictures here, these are red blood cells, right? These are red blood cells. But what you then need to be able to identify are these cells here. So you must be able to identify this cell and distinguish it from the cell in the middle slide here. Right. So these in the middle slide, these are going to be eosinophils. Right. So those are eosinophils. Then on the upper three here, these are neutrophils. Then the bottom one, these are basophils. Right. If you look at the neutrophils, you look at the nucleus. Remember, they have a nucleus which can be trilobed, which can be considered to be trilobed. Right. They have a nucleus which can be considered to be trilobed. These neutrophils, the eosinophils and the basophils, they are considered granulocytes because on top of having the azurophilic granules, they also have specific granules. Right. That's what differentiates them from monocytes and lymphocytes. because they have those specific granules. The monocytes and the lymphocytes, they will also have the azurophilic granules, which are basically lysosomes. Right? So those are the neutrophils. They're the most abundant white blood cell. Right? Diameter-wise, they're about 10 to 12 micrometers. Right? Then they may show presence of a bar body, which is the inactive X chromosome in females. Right? And that bar body shows a drumstick shaped appendage here on one of the nuclear lobes. So you have a drumstick nuclear appendage. Right? Then for the specific granules that you find, they will work in fighting infections. Right? And remember, neutrophils are the first cell in inflammation, that is acute inflammation. They are the cell involved in acute inflammation after diabetes. Right? Then these are your eosinophils. They fight parasitic infections from your biochemistry and your physiology. So those are the eosinophils. They also have the azurophilic granules and the specific granules. Right? They fight those parasitic infections. They're also involved in allergic reactions, as well as a bit of chronic inflammation. Right? Then the nuclei can be bilobed, as you can see there. Then these are your basophils. Right? They are almost the same size with your neutrophils, the basophils. They are named basophils due to the presence of the large granules that you see there, which give the cell a highly basophilic appearance. Right, so these are your basophils. Right. And for your white blood cells, these are going to be the least abundant. Remember I said the neutrophils were going to be the most abundant. These are going to be the least abundant. Right. Then this slide here shows us lymphocytes. This one, those are blood monocytes. And of course, the red bits there, they are your red blood cells. If you look at the nucleus of a lymphocyte, it's about the same size as a red blood cell. Right. Your lymphocytes are the most common granulocytes. When we compare these lymphocytes and the monocytes, the ones that are more abundant are going to be these lymphocytes. And they account for almost 30% of the total leukocytes in the blood. Right. And remember, your lymphocytes, you're going to have the T and the B. And histologically, you cannot differentiate the T cells from the B cells, or that's morphologically you can't. But if you do immunohistochemistry, you can differentiate them. Right. Then remember the T cells, they work in the cell-mediated immunity. The B cells will work in your humoral immunity, where they mature to become plasma cells, then they start to secrete antibody. Then these are the monocytes. Remember the monocytes, that's in blood. In tissues, they mature to become macrophages. For example, in the liver, you talk of Kupffer cells. And the respiratory system, you talk of alveolar macrophages and dust cells. In the skin, you talk of Langerhans cells. In the central nervous system, you talk of microglia. Right? Those are simply all going to come from these monocytes. Those monocytes, when they actually antigen presenting cells, when they become macrophages from your physiology. Right? Then right there, that's another platelet. Right? Yeah, that's another platelet. Right? So those are actually going to be derived from thrombocytes, which are polyploid cells, which you expect to find in the bone marrow. Right? So you should be able to distinguish those 5 cell lineages: the neutrophils, the basophils, the eosinophils, then your lymphocytes, and then the monocytes. Then this is a bone marrow smear. The bone marrow smear shows us these are adipocytes, right? Then if you come this side, that's a megakaryocyte. Remember I said a megakaryocyte will be polyploid. That's a megakaryocyte. Right. Right here we'll be having erythrocytes. Right. Then that developing right there, that's an eosinophil. That's another eosinophil there. Right. Then the white regions, those are going to be fat. Right. Then this is also bone marrow tissue. This is bone trabeculae, your spongy bone, if you remember bone histology. This is fat. That's fat, that's fat, that's fat. Then those are the developing lineages of the cells within the bone marrow. Right. So you should be able to see a normal bone marrow. Right? This is normal bone marrow tissue. Right. Then these slides here, they show erythropoiesis. This right here, that's a pro-erythroblast or a pro-normoblast. Right. This pro-erythroblast is large, right? And it's the largest in the series that is going to follow that we're going to show you. Right. So this is a pro-erythroblast. The pro-erythroblast progresses to a basophilic normoblast or a basophilic erythroblast, this one. And it's quite smaller as compared to this one, as you can see. And you have a decrease in the nuclear to cytoplasmic ratio in this basophilic normoblast. Right. Then from there, we move on to this one. This one, it's a polychromatophilic erythroblast. Right? This is polychromatophilic. This one is the basophilic that I just showed you there. This one is polychromatophilic. Right. Then we see a pronounced clumping of its chromatin here. Then you also see other regions that are lightly stained there. Right? Indicative of now hemoglobin production that is starting. Then these are chromatophilic. These are orthochromatophilic erythroblasts and normoblasts. This right here is a neutrophil. These are orthochromatophilic erythroblasts. The nuclei are becoming smaller, as you can see. The cytoplasm is becoming more eosinophilic on the outside there, indicative of more and more hemoglobin. So that's your orthochromatophilic. Then these here are polychromatophilic. Right. The nucleus has been removed, it has been extruded. These are also known as reticulocytes. They make up 1 to 2% of the total normal circulation. Right? And they're the ones that then mature to become the red blood cells. Right? Then this is a myeloblast. Right? You can see the deep blue nuclei and the cytoplasm there. That's the deep blue cytoplasm. Then we can see this deep purplish nuclei right there. That's a myeloblast. This is a pro-myelocyte. There's a round nucleus. Right? That's a pro-myelocyte with a round nucleus right there. Right? Then we can see presence of nucleoli. Right? For example, there. Right? That's a nucleoli right there. Then If you come to this lineage, this is the eosinophilic lineage. This is an eosinophilic myelocyte. This here is a neutrophilic myelocyte. Right? The neutrophilic myelocytes too has a round nuclei. Right? And the nucleus, you can see that it's actually almost going to become bean-shaped. Right? In the neutrophilic metamyelocyte here. Right? But if you come to the eosinophilic metamyelocyte, this one, the nucleus is still going to be bean-shaped like the metamyelocyte on the side for the neutrophils. But you now have a characteristic eosinophilic appearance of these granules. Right. Then these are now going to be the immature cells, the band cells that can be produced. You can have an eosinophilic band cell, you can have a neutrophilic band cell. And they exhibit a horseshoe-shaped nucleus, which can be extruded into the blood to fight acute infections and everything. And they may be produced without that bilobed appearance of the nuclei, right? For example, here, that's a band cell right over there.